Good morning, everyone. I am a second year GCM student, Sayeda Hajra, here representing the Department of Microbiology. In this video, I am going to be speaking about a severe outbreak happening in Japan due to a disease called necrotizing fasciitis. A rare and deadly disease caused by a flesh eating bacteria is spreading rapidly in Japan, particularly in Tokyo. Streptococcal toxic shock syndrome is an aggressive illness that can be fatal within 48 hours of infection. This is also known as necrotizing fasciitis.
As of 2nd June, streptococcal toxic shock syndrome cases nationwide have reached 997, surpassing last year's total of 941 cases, as reported by Japan's National Infectious Disease Institute.
What is the cause of streptococcal toxic shock syndrome? Streptococcal toxic shock syndrome or necrotizing fasciitis is commonly caused by a group A streptococcal bacteria GAS. They are spherical, ovoid, gram-positive, non-motile, non-spore forming, occur in chains and form grayish-white translucent colonies on blood agar after incubation. Several other types of bacteria, including Vibrio vulnificus, Staphylococcus, have also been linked to the disease. What is necrotizing fasciitis? Also known as flesh eating disease, it is a rare infection of skin and tissues below it. Necrotizing means causing tissue death, and fasciitis refers to fascia inflammation, which is tissue under the skin. This life threatening infection affects the skin, muscles, and soft tissues and causes patches of tissues to die. It spreads quickly and aggressively in an infected person, causes tissue death at the infection site, and can be deadly if not treated right away. So let's talk about the pathogenesis of this disease. The bacteria enters the body through an opening in the skin such as a small cut, graze, pinprick, large wound such as trauma or surgery, or even through direct contact with an infected person. It also occurs in patients who are obese, diabetic, pregnant, or have cancer. The streptococci then invade the immune system and produce a toxin called cysteine protease SPEB, which dissolves tissue. This causes the necrosis of the facial skin layer. Initially, the infection spreads horizontally, then vertically down into the deeper layers of the skin. Thrombosis or blood clot occurs in the arteries and veins, leading to the reduced blood flow and further necrosis of tissues. The bacteria also produce hydrogen, nitrogen, and hydrogen sulfide gases that destroy hyaluronic acid, enabling the spread of infection. So, what are the symptoms and complications of necrotizing fasciitis? Early symptoms include red, warm, or swollen area of skin that spreads quickly, fever, severe pain, including beyond the area that's swollen. Later symptoms include changes in the color of the skin, dizziness, nausea, fatigue, diarrhea, pus or oozing from the infected area, ulcers, blisters, or black spots on the skin.
Complications that may result from this condition include infections that spread throughout the body, causing blood sepsis or blood infection, severe scarring, and even loss of ability to your arm or leg.
So, how can necrotizing fasciitis be diagnosed and treated? Diagnosis includes blood tests such as complete blood count, tissue biopsy, CT scanning, or culturing of specimen taken from deep tissue. Treatment includes surgeries to remove infection and dead tissue, antibiotics, intravenous fluids, and skin grafts. So, how can we stay safe from necrotizing fasciitis? According to CDC, the following methods can help prevent this infection. Number 1, good hand washing. Number 2, wounds should be cleaned and monitored for signs of infection. And number 3, patients with infected skin should seek immediate medical attention. Thank you for watching. To learn more about microorganisms, the friend and foe in our everyday lives, make sure to check out the other videos posted by the Department of Microbiology.